So today we are going to start one very important topic in biochemistry as well as medicine, that is vitamin A. Okay, this topic is very important. When you start practicing as a doctor, it will help you understand the disease process, the treatment protocol of patients. Okay. So this is actually this class is correlation with clinical topic as well. Let's start. Vitamin A. So I think this is your first class vitamin, na? This is your first class in vitamin. Vitamin B complex complete. Vitamin E complete. B. There is water soluble vitamin. Okay. So, anyone tell me the classification of vitamin? According to solubility. Water soluble vitamins, B complex, vitamin C, folic acid, and fat soluble vitamin A, D, E, K. Okay. Vitamin A, it is also called as retinol. Some of the metabolites of vitamin A are there: retinoic acid, retinal, that is LDL part. Okay, retinol, and retinoic acid. These three are very important. Apart from this, that carotene, especially beta carotene, which are actually plant source of vitamins, vitamin A. Okay, beta carotene. So let's start our discussion from history. In 1913, McCallum and Simons identified the vitamin A activity in diet, and Richard Ford identified carotenes. He was awarded Nobel Prize in 1938. In 1931, Paul Carrot described the structure of vitamin A. That is why he was awarded Nobel Prize in 1937. George Wald described the visual cycle and identifies the role of vitamin A in vision. He was awarded Nobel Prize in 1967. And Torsten Wissel worked on dove adaptation. He was awarded Nobel Prize in 1981. These are something about history of vitamin A. Okay. Let's start chemical structure. This is benzene. This is common structure of vitamin A. Benzene is there. But from this side chain is there. This side chain can fold here in 11 carbon, and this structure is called all trans retinol. Is changed to 11-cis retinol. And this is a beta carotene structure. See, here two benzene is there. They are held together by in their chain. So when they cleave, they give rise to two number of vitamin A. Okay. See, retinoids. Retinoids are actually common term of vitamin A. There are three types of retinoids. Three are important in our body. All of three are important in our body. They have different role. First one is retinol, that is aldehyde form of vitamin A, also called aliphancils retinol or retinaldehyde. They are take part in vision. Next one is retinol, that is alcoholic form of vitamin A. There are functions as iron utilization, humoral immunity, T cell mediated immunity, okay, natural killer cell activity, and phagocytosis. Okay, so a lot of functions there vitamin A. Again, retinol, their function is iron utilization, humoral immunity, T cell mediated immunity, natural killer cell activity, and phagocytosis. Okay. Next one is retinoic acid. This vitamin A, it functions like steroid hormone. Because you know, steroid hormone has intercytoplasmic nuclear receptor is there. Steroid hormone. Retinoic acid also have intercytoplasmic nuclear receptor. Their function is normal morphogenesis, cell division, growth, and cell differentiation. Okay. Next is provitamins. These are actually plant source of vitamins, abundant of beta carotene. Beta carotene, when eat in intestinal mucosa, they are digested by enzyme, deoxygenase enzyme, then broken down and make 2 retinol. Okay. In nature, there is more than 600 carotenoids present. Among them, approximately 50 carotenoids they metabolize to vitamin A. This information I have taken from Harrison's Internal Medicine. You can go through Harrison. Okay. Understand? Next. Let's start something about retinoic acid. As I told earlier, retinoic acid is act like steroid hormone. Steroid hormones have intercytoplasmic nuclear receptor. So, inside the cell, in nuclear receptor, it has ligand with some nuclear receptor that act as transcription factor. What is transcription? DNA to RNA. This is called transcription. Okay. In order to do that, you need some factor. This factor bind with specific site of DNA, that is called gene, then either activate or depress gene, and accordingly the product produced. So retinoic acid has some nuclear receptor. It is ligand for some nuclear receptor that act as transcription factor. two types of receptor is there. One is retinoic acid receptor, that is RARs, and retinoid X receptor, that is RXR. These receptors regulate transcription by binding as dimeric complex. To specific DNA site. Retinoic acid bind with some other substance, especially intracytoplasmic retinol binding protein, and form dimer. By this way, they bind with specific DNA site, that is gene, and then the retinoic acid response element, and then target gene activated. The receptor either stimulate or repress gene expression in ligand response. Either they activate or repress gene. RARs bind all trans retinoic acid and cis retinoic acid, and where RXR bind only non-cis retinoic acid. Understand? Yes. Okay, let's move. Retinoid receptors are control cell division and cell differentiation. As I told earlier, they bind with gene, then stimulate gene. By this way, transcription occurs. By this way, they control cell division and cell differentiation. They produce some growth factors, some hormones like this. Okay. These retinoic acid are used as treatment for promyelocytic leukemia. In leukemia, what happens? There is an uncontrolled proliferation of leukocytes occurs inside our body in blood. There is all type of blood cancer. So promyelocytic leukemia type of blood cancer, this retinoic acid can be used as medicine. And also they used as cystic acne because it inhibits keratinization and lowers sebum secretion. So in acne treatment, 13-cis retinoic acid, there is also called tretinoid used. Commercially available drug is there. Tretinoids. You learn in pharmacology in future lectures. Okay, just listen today. Next, RXR dimerized with other nuclear receptors. And then what happened? The function is co-regulators of gene expressive to retinoids, thyroid hormone, and calcitriol, vitamin D. RXR also agonist, they induce insulin sensitivity experimentally. Some drug is there like rosiglitazone, pioglitazone, they act like this way. Anti-diabetic type. Rosiglitazone, pioglitazone, this kind of drugs, they act in this way. Okay. Next, digestion. As I told earlier, plant source of vitamin A is beta carotene. Beta carotene, when we ingest, in intestinal mucosa. They are broken down by dioxygenase enzyme in 2 molecules of retinol. And again, this retinol, this enzyme retinol reductase, they convert retinol into retinol. In animal sources, we consume usually in retinal ester. And this retinal ester hydrolyzes in retinol and free fatty acid. By this way, digestion occurs. Once this retinol is formed, this retinol is incorporated with chylomicron and bile salt. Then they go into lymphatics. By the lymphatic, they go into liver. In the liver, they store as retinal ester. See, in intestinal lumen, retinol is esterified, retinol ester, and then they by a chylomicron they go into liver. But there they stored as retinal ester. When it required, the retinol release into blood and bind with retinol binding protein. They form a complex retinol and retinol binding protein. This thing actually easily filtered out by kidney glomerulus. So, in order to do that, it again binds with another molecule, this transthyretin. Transthyretin and forms a trimolecular complex. Retinol with RBP, retinol binding protein. This thing easily filtered out by kidney glomerulus. So, in order to do that, our body make another protein called transthyretin and forms a trimolecular complex. By this way, this thing can prevent filtered out by kidney. Okay. Then this whole thing circulates in the blood and reaches in the tissue. On the specific site, they deliver this complex and this thing RBP has receptor on different site. Once bind, this retinol internalized into the cell. Okay, and inside the cell there is one intercytoplasmic RBP is there, intercytoplasmic retinol binding protein. Understand? By this way, the reaches into the target site, vitamin A. Understand? Any question? Next, function of vitamin A. Most important is Ward's visual cycle. WALT. Ward's visual cycle. These things may come in your exam, so read it very carefully. Ward's visual cycle. Long question, so read this very carefully. Okay? So in our both eyes, we have retina. You know, retina. In retina, there is two types of cells there. Photocells. One is rod cell, another is cone cell. Their name come from their pigment. Rod cell, they have rhodopsin, and cone cell, they have podopsin. Rhodopsin, cone cell है podopsin. Okay, so what research cycle describes rhodopsin, start from rhodopsin. Rhodopsin, when light hit in the retina, the rhodopsin convert to wall-trans retinol and opsin. This is actually light breach occurs by photon. Light is pack of energy. This is called photon. You know everyone, photon. So when light hit in the retina, this rhodopsin convert to wall-trans retinol, and there is some intermediate form is generate. Each has very short lifetime, few picosecond to microsecond. Rhodopsin convert into beta rhodopsin. Next, luminorhodopsin. Next, metarhodopsin. One, metarhodopsin 2. Four. Okay, these are the intermediate: rhodopsin, beta rhodopsin, luminorhodopsin, metarhodopsin 1, metarhodopsin 2, which actually activate transducin, and then finally they generate opsin and wall-trans retinol. Each intermediate has very short lifetime, picosecond to microsecond. The wall-trans retinol is released from protein opsin. Okay. Then this trans retinol released in the blood via it reaches in the liver. On the liver, this trans retinol convert to trans retinol. Just see carefully. Trans retinol convert to trans retinol by the enzyme alcohol dehydrogenase. Here required NADH combined to NAD plus. Alcohol dehydrogenase have a cofactor zinc ion. Everyone should know. LDH has alcohol dehydrogenase has cofactor zinc. So in zinc deficient patient, the patient may suffer this conversion. This cycle can hamper. Patient may develop some visual problem. in zinc deficient patient. Okay, understand why this is indirect process? Because of zinc deficiency, this activity decreases, ADH. Don't talk, please. Don't talk. Okay. Then this trans retinol then convert into trans cis retinol by retinol isomerase enzyme present in liver. This cis retinol again convert to cis retinal. This same enzyme ADH in liver here is utilize NAD plus and generate NADH. This cis retinol then released into blood via bloodstream. That reaches again into retina. And again retina it is spontaneously convert to 11 cis. Any question? Spontaneous convert to 11 cis retinal. Then this 11 cis retinal then again attached with opsin and regenerate rhodopsin. By this way, this visual cycle complete. You understand? This is a normal process, but in dark area, this trans retinol then convert in cis retinol by retinal isomerase enzyme. So in dark area, it takes some time, few second to few minute. Okay. So in patient with vitamin deficiency, this conversion disturbed. Again, vitamin deficiency, the whole process disturbed because of deficiency of vitamin A. Generation of nerve impulse. Metamorphin activities transducin. Say this is a diagram of rod cell. So this is a rod cell diagram. Okay, this is nucleus. Here we have rhodopsin. Here we have sodium, potassium, ATPase pump. Sodium, potassium, ATPase constantly throwing out sodium ion to inside to outside and taking inside potassium ion. Here we have some sodium channels. Sodium channel are nothing but CGMP, cyclic GMP. Okay. When light hit rhodopsin, the rhodopsin converted to metarhodopsin 2. This stimulates this one, rhodopsin. There is also called G protein. Once G protein activated, say metarhodopsin 2 activates transducin, visual pigment have G protein coupled receptors. 11C retinal locks the receptor. Transducin is G protein in retina, as I told earlier. Transducin is bound to GTP. It is inactive form. How activated? It activated by GTP binding by metarhodopsin 2. Okay. This active GTP transducin increases the activity of phosphodiesterase enzyme. This PD, phosphodiesterase enzyme, broken down cGMP into 5' GMP. So by this way, the intercyclic GMP level decreases. So this thing blocked. By this way, the hyperpolarization occurs. Say normally it is minus 30 millivolt inside. On hyperpolarization, it may go up to 60 millivolt. Example. By this way, nerve impulse generate. Understand? Because sodium channel blocks, though inside there is sodium cannot move, there is why the negativity increases. Okay. This is quite difficult, but you have to go through some video. YouTube video is available. You can see it and understand well. Okay. So how this process stops? Nerve impulse is terminated by phosphorylation of a serine residue of activated rhodopsin by rhodopsin kinase enzyme. This causes beta arrestin can bind and inactivate rhodopsin. Intensive GTP activity of alpha subunit hydrolysis GTP to GDP. So inactive transducin no longer act on phosphodiesterase enzyme. By this way, guanylyl cyclase converts GTP to cGMP. By this way, GMP level restored. And again, sodium ion channel activated. Okay. Okay, let's move. Other function of vitamin A, gene regulation. As I told earlier several times, gene regulation, immunological system, as I told earlier, reproductive system, because retinol has a steroid-like hormone action. It is antioxidant property. So vitamin deficiency causes some coronary artery disease, atherosclerosis, cancer. This incidence increases and it reduces oxidative stress. Effect of skin. Retinoic acid maintain normal skin health by switching genes and differentiating keratinocyte. There is immature skin cells into mature cells. So if you want to see a good healthy skin, you have to consume vitamin A sufficiently regularly. Understand? Some disease process occurs because of vitamin deficiency. First one is night blindness. We also call as nyctalopia. Dark adaptation time increases. Mother may come to you in OPD. They can told, my child cannot see in dark. This is the first complaint of mother. Immediately you can realize that this baby is suffering from vitamin deficiency. Okay, this is the first time. Next, first symptom actually. Next sign is dryness of conjunctiva. And bitter spot. What is bitter spot? This is a triangular shaped keratinization about the outer side of both eyes. Bitter spot. This is second stage. First stage is xerophthalmia. This is dryness of conjunctiva. Then next is bitter spot. Then this incidence continues. Then develop keratomalacia. This is one very bad condition. The transparency of cornea decreases, lost. If this condition continue, patient may develop total loss of vision. This is one of the most important and common cause of blindness in India. Vitamin A deficiency. And of course, this is preventable. This is bitter spot. This is keratomalacia. See this hyperkeratosis. Few days back, I have seen one patient in my clinic, the case of hyperkeratosis. The skin manifestation. Next is acne. Because of decreased sebum production. Acne you will read in your skin lecture classes later. Growth retardation because of defective chondroitin sulfate synthesis in bone. The causes decreased bone growth. Okay. Scalar growth, retardation, decreased protein synthesis, decreased glycoprotein content in cell and reduce immunity. Okay, vitamin A. Next is how to assess vitamin deficiency. First one is the increased time for dark adaptation. Say in normal people, maximum 1 or 2 minutes required for dark adaptation, but in vitamin deficiency it takes longer time. Next one is you can level serum retinol level. Normal level 30 to 100 microgram per deciliter. Laboratory you can estimate this. Next is RBP level, retinol binding protein level in serum. The level can decrease. And next one is liver biopsy. Because you know, as I told earlier, 90 to 95% vitamin A stored in liver. So when there is deficient condition, so in liver biopsy you can see very less amount of vitamin A in liver. Okay. Treatment. xerophthalmia. Treatment is 60 milligram vitamin A capsule. The subject capsule available. You can give first day, day 1, then day 2, and then day 14. And in case of 6 to 11 month children, you can give 30 milligram. Duration same, day 1, day 2, and day 14. And mother with bitter spot, 3 milligram daily or 7.5 milligram twice a week for 3 months. Okay. Read this treatment. I taken it from Harrison. Preventable dose in children, supplement of every 4 to 6 month interval. In case of 6 to 11 month, old children 30 milligram, and 12 to 15 month old children 60 milligram. And low birth weight, especially high risk children, male or birth weight is less than 1 kg, they invariably develop vitamin A deficiency. So give them 1.5 milligram 3 times per week for 4 weeks, first month. Okay, and severe measles, because in measles patient they develop vitamin deficiency, give them 60 milligram 2 consecutive days in hospitalized patient. Understand? Everyone take this screenshot, because in your textbook you may not find this. In your future lecture classes in PSM, you have some dose protocol, because each and every year or some protocol come, new protocol. So you have to go through that protocol. Right now, just remember this. Okay. Next, RDA, daily requirement. Adult male 1000 microgram per day, female 850 microgram per day, pregnant mother 900 microgram per day, lactating mother 950 microgram per day, infant 350 microgram per day, children up to 9 years 400 to 650 microgram per day, adolescent boy 700 to 1000 microgram per day, and female adolescent girl 700 to 850 microgram per day. This is daily recommended dose for vitamin A. They may ask in your Viva exams, so remember this. Okay, just move. Dietary sources: a plant source, dark colored, especially yellow colored fruits like carrot, pumpkin, mango, a very good source of vitamin A. Papaya. In animal, cod liver oil, meat, egg, liver. This is a very good source of vitamin A. What is hypervitaminaceous? If you consume large amount of vitamin A, then you can develop toxicity, because this is a fat soluble vitamin, so you cannot excrete directly like water soluble vitamin. Eventually it go and store in your body. Okay, so if you consume a very large amount of vitamin A, eventually it develop toxicity. For the symptom toxicity, first symptom anorexia. Good morning. Irritability, headache, drowsiness, nausea, vomiting, increased intracranial tension. This mimic pseudo tumor cerebri. Because if you develop tumor inside brain, they develop this kind of symptom: nausea, vomiting, headache. So it mimic CO2 tube by cerebri. Painful swelling, if you continuously ingest vitamin A in high doses in prolonged time, then you develop painful swelling of our long bones. That is called bony exostosis. Sometimes children may develop hepatomegaly. A high concentration of retinol increases lysosomal enzyme activity, leading to cellular death. Because lysozyme is a destructive enzyme. Next is, what is hyperkeratonemia? If you consume great amount of carotene, you develop hyperkeratonemia. Patient may develop yellowish discoloration of skin, but not sclera. So this is not jaundice. This is non-toxic, no problem actually. If you stop eating carotene, they eventually go away spontaneously. Do you everything understand? No question at all? So, thank you.